We keep hearing about the importance of preventing health problems and pursuing wellness, but increasingly the pursuit's a matter of people acting together, especially in the workplace. One example is the Bowdoin Street Health Center in Dorchester. Its Workplace Wellness Challenge program recently won this year's Mayoral Prize for Innovations in Primary Care in a Workplace Setting. To explain how it works are two guests from the health center who played a role in designing the program, community health specialist Maura Ackerman and community health worker Jen French. Thank you both very much for being with us.
Thank you for having us.
I want to start with Maura. I guess one of the things you do with a program like this is that you have to figure out how is this going to work for the people that we're getting involved. So what did you do with that?
I think it was really exciting for both Jen and I to kind of design a program that really met people wherever they were in the process of wellness and kind of had multiple entry points. So some people were really excited about cutting down their sugar-sweetened beverage intake. Some people were excited about taking more steps. Some people were excited about cooking at home more. And so we tried to design a challenge that kind of met people on each of those things and got them excited and taught them more about the areas where they knew that they needed to make improvements and maybe some of the areas that they didn't, like stress reduction or getting more sleep or things like that. But trying to have a variety of ways for people to engage with the challenge and to engage in improving their own health.
Jen, talk about what you were doing in this part of the program, what you worked on the most.
It was actually a pretty great partnership. Both Maura and I were excited to have something really innovative and, like Maura said, something that was new and exciting and met people where they were at, and not just a one-time challenge where we tell our staff to take the stairs for a week or to try to increase their water intake. We really wanted to do something on a much larger scale, and something that I think that would kind of set a new standard for people as individuals. So we kind of started off brainstorming all of the different avenues of health which we felt were important in the general area of wellness, and what we thought we could improve on in the workplace and with each other as a team, using each other as support. So we ended up with not just a 1-week challenge, but more of a 10-week challenge. So we worked hand in hand designing how to capture data, how to keep up morale, how to encourage staff participation, and how to deal with the unexpected. Maybe people wouldn't respond to one of the challenges as well as we thought, but I think we were both very pleasantly surprised at the outcome.
Yeah. Maura, what about support and morale? Were there times when people might have been a little discouraged?
I'm surprised to say it, but I think that we actually kind of coasted right through, and even excitement even built over the course of the program. So we had people competing as individuals, but also competing as teams. But then overarching all of that was a cooperative goal to walk as many steps as possible and to lose a collective amount of weight, both of which we achieved exponentially well. And so it was very exciting to kind of just see each week someone trying to be a little bit more competitive and get their edge, or someone really sending out an all-staff email trying to encourage everyone to take more steps over the weekend and do some fun thing. So I would say that actually somehow we didn't get the kind of diminishing effects that we would have expected in, say, week 8. People just kind of kept building their excitement throughout the challenge.
What about that competition? Because I'm wondering, like, it seems to put people on the spot in a way, but on the other hand, just knowing that somebody you work with can do something makes you think that, well, maybe I can do that too. Exactly,
and that was a big part of why we had so many ideas and segments around this whole team-based approach. And at the health center, that's what we do as a patient-centered medical home. It's all about a team-based approach to care and having all of these different players be a part of the same puzzle. And that was one of the things we talked about with this challenge, is having that element of support, having that element of seeing your coworker do something and wanting to step up your game a little bit, and having people there for you when you really needed help, or anything of that nature. But I think the team dynamic and having a little bit of the competition thrown in there, it kept things exciting, and it kept people motivated, and I think it kept people wanting more. Now that the challenge has been over for a few months, we still have people coming by and asking what's next, and what else we can do in the health center, and how we can translate what we created to our patient population and the larger community.
Well, what about the results from this?
Well, I think it's really exciting. We obviously walked, we intended to walk from Boston to Miami Beach. We ended up hitting up 7 deep beaches all over the country and down into Mexico and Guatemala and all the way to Panama City. So that was very exciting. I think that what's also exciting is that at the outset of the challenge, we asked people to kind of rank what goals were most important to them that kind of aligned with the 10 weeks of themes that we had come up with. And people ranked them. And then at the end, they talked about how significant the changes they made along those same goals. And indeed, they kind of matched up one for one. The goals that people thought were most important at the beginning were the ones that they made the most significant behavior change. So that was really exciting to see.
Jim, one of the things you mentioned was about drinking water. Now, I know I keep hearing about why it's good for people to walk more and use the stairs more, but what's so important about water?
Water, I think water is great for us on a variety of levels, but we started just with a simple, one of the themes behind the whole challenge was making the healthy choice the easy choice, not having to go out of your way to be well in the workplace where we spend the most time. And so we distributed water bottles and encouraged people to use them throughout the day, and we kept water pitchers at each staff meeting, making it very easy. If you're stuck in meetings all day, it doesn't matter. You have a pitcher of water right in front of you. But along with each challenge, each week we sent out an email with links to why it's important. Water keeps you hydrated. It helps your muscles function better if you exercise. It keeps you more alert. The risks of dehydration or stress. So each week when we sent out a new email about the challenge, we gave the list of reasons of why that challenge was important and why it positively affects your health, and a variety of ways which you can, incorporate that into your lifestyle.
What about reducing the stress, Maura? Anything you can say that you were able to get about how much of that actually happened?
I think that was actually the area where we didn't do as well as we would have hoped. That was the one area where we didn't make as much change, and you can understand that in a primary health setting that we're all working our very hardest. But I think it was great to kind of take a moment to step back and to recognize that that's an important priority, that while it's a challenge, is something that we all need to strive for. And so we did devote a staff meeting actually to doing a guided meditation. That was really exciting. So one of our staff members led that for us, and everybody taking 5 minutes to just sit back and relax their minds and calm themselves in the midst of the kind of hectic work that we do was really powerful. And so, even the things where we didn't make as much progress, I think that it was a moment of thinking back and thinking forward to how we can make ongoing changes, and how the investment is a long-term one and not one that we can expect in 10 weeks alone.
Jen, as far as this investment here, sometimes even a small change in some indicator like blood pressure because you've changed your diet a bit, that can make a big difference to people.
It does. It definitely does. And, and that was something that we tried to be pretty vocal about, is that, wellness and changing your health doesn't mean you need to go to the gym for 10 hours a day or eat only salad for lunch. It's these little tiny changes that affect the overall big picture. And I think we're really excited to see what happens next and how our staff take this to the next level themselves.
Thank you both very much, Jen French and
Thank
Maura
you.
Ackerman from the Bowdoin Street Health Center. Up ahead, a celebration of immigrant heritage and contributions.